This is a Kinesio tape for the knee. This patient has a, unfortunately, you know, it's joint inflammation, joint arthritis, where the knee joint has decreased in size. And so she said that the Kinesio tape really helped her. So I'm going to do it again on her. She doesn't want to have surgery. She wants to delay it as long as possible. So the way I test it, you know, you can learn how to do this at home, but it can be a little bit more. It takes more practice to do muscle testing. So, but you can just copy the way I do the testing and copy the way I do the Kinesio tape at home if you don't want to do the muscle testing. But I like to muscle test it because then I can see which direction to put the Kinesio tape. So the way we do this, muscle testing wise, is I like using the calf muscle. The calf muscle is a really good way to muscle test. So if you can see my thumb on the camera, okay, it stops pretty quick when I muscle test. No, it's not good. No, not good. Spin it up a little more. Okay, see, that's good. Okay, so now you can relax the knee. So now relax this knee here. So now I push the opposite knee on the left here in different directions, and basically to see which way I want the tissue to be pulled. I squeeze it, and then I muscle test it at the same time. See, I'm getting a reaction right there. Here's before, it locks real quick. See, the thumb doesn't move that much. As soon as I squeeze the knee under the patella, see how it moves? Can you see that? So that's a good muscle test, meaning that you like this position. So I would put a Kinesio tape like this, and that's called a space. So what I'm doing is squeezing right underneath the patella and squeezing it, and that's the direction the tape is going to go. So I'll just do that right now. So I usually do two types of tapes in the office. I cut them. I have my son cut a bunch up, and they're either going to be 3 blocks. Okay, 3 blocks like that, and it's Kinesio tape gold. Now there's a cheaper Kinesio tape that works too, but I've tried the cheap ones, the mock brands. The ones I've tried doesn't work. It just peels off the same day. These stay on for 3 days. Mm-hmm. Okay. Sometimes you need to, you know, to put alcohol on it to dry it so that it doesn't, so that none of the oils make it peel. Okay. So the Kinesio tape gold's good. So I do the three blocks, and then I do a longer one for 4 blocks. Sometimes you may need a shorter, sometimes you may need longer, but most of the time this is the 2 that I use. I cut the corners like this, okay, so that it doesn't peel off as if you leave the corners on after you cut it, it's easy to snag. So I like to do the, you don't have to, but it's better to do that way. So when I test it, I squeeze the patella and I got a muscle reaction. That's the muscle testing. I like that because it tailors it to you. What does your body need? But since you don't know how to muscle test at this point, you can just repeat it. Just squeeze it, just put the Kinesio tape on. It's called space correction. So you're going to do is, in the space correction, you're going to tear it in the middle, tear the tape. Peel the tape on both sides like this. You grab it on both sides. This is where it takes finger dexterity a little bit. So I'm grabbing the tape and grabbing the edges, it's peeled off, and I stretch it. So I usually stretch pretty well. So this stretch is the magic. Why? Because it's like somebody putting constant pressure in the right direction in your knee, and you wear it for 3 days. So, and the tricky thing about this is you got to put the joint in its end functional range. So you don't want to put it when it's straight like this because you're not normally having it like this the whole day. So when you're walking, you want to put it in this position because then you put the tape on, so then it doesn't feel like if you go like this, it doesn't take the tape off. Okay, so go ahead and bend the knees all the way. And this is where you have to know a little bit of anatomy. So you're going to have to look it up, patella. It's infra patella, right here, you know as a nurse. And you just put it right underneath the patella, stretch it, close to 100%. Put it down and let go. So this ends, these 2 ends, don't get any stretch at all. So I just lay it down. See, no stretch. And I just lay it down. This side too as well. Try not to have any wrinkles. Make it look pretty. I put a cross the other day on someone. Okay, you got the cross of Christ now. Let's see if we need something in that direction. So okay, so that's one. So now we've got increased space of that knee, it increases the space because it bunches the tissue together. It allows for breathing better. It allows for better circulation. And I'm going to go there. Now let's check the back of the knee, because sometimes it's the back of the knee that's causing the problem, the hamstring. So let's check the calf muscles. Sorry. Not really picked up a lot there. Let's check the adductors, the TFL. I check all the muscles, and this is where you have to know anatomy pretty much. I mean, so far, I'm not really picking up a lot. Sometimes the quads are involved, because if you have weak quads, it pulls on the patella the wrong way. Not really picking up. I check the sartorius. Every muscle that attaches to the knee, I check. So the sartorius, you have to look these up and see if I get a. Does it hurt to like do Indian stuff?
No, it hurts more to hyperextend.
So are you flexible? I think we're okay. I'm gonna just try. Let's just try starting with this, a simple way. I'm not picking up any other muscle testing on you. So we'll just keep it simple.
Okay.
Just do a tape like this and try to keep it on pretty much all the time.
Okay.
You know, every 3 days replace it. And when you're doing Kinesio tape, you know, you never want to hair dry it in the shower. After the shower is wet, don't hair dry it because it makes it stick more. After you put on the tape, you're rubbing it because the heat stimulates it to stick better. And when I'm rubbing the edges, always rub, you know, so you don't, lift it up, right? Rubbing direction so that you don't lift the tape up. Because once the tape is lifted up, then it can start to peel. Okay? So I'll give you a couple extra ones for now, and then you can just replace it. You'll have a week's supply. So let's see how that helps, and then let me know next week. Just double check.
I can feel where your thumbs are is where it hurts, believe me.
Right here?
It shoots up my...
It shoots up? Is that where you have the pain? Okay. So this is where I probably would do some ART, which is basically active release, and see if I get some tenderness. Does it hurt a little bit? And I'm looking for restrictions in the joint itself. I'm putting my finger in between the joints. That's not a lot. It feels like it's loose. It's tender because you have inflammation there.
I also have a torn meniscus on that side.
On this side? Okay. So I'm picking up a restriction in rotation to the lateral rotation restriction. It's not moving in this direction, the tibia over the femur. So what I would do in this case is just do a drop technique. Go ahead and sit up. And don't look at the camera.
Okay.
So it's going to slide all the way back. So I would do a drop technique on this and just adjust it this direction. You're going to feel a drop here.
Okay.
This is nice and safe and gentle. You okay?
Mm-hmm.
And sometimes I would even distract it with my leg while I'm adjusting it. Distract this and go straight down. Let's just check to see. That lines it up a little bit better. Okay. So that's good. So that's the chiropractic portion of it. So I'll see you next time.